Hello everyone, this is Gautam Bhaskare. Today we are going to learn about the shoulder joint. Okay, so basically shoulder girdle or else we can say shoulder joint is a complex osteoarticular unit that connects the upper limb to the axial skeleton. That means whatever you are having in your axial skeleton, that is your vertebral body, okay, your ribcage, your sternum. Okay, so the shoulder girdle connects your upper limb, okay, to that axial body. Okay. Then coming to it permits greatest range of motion. Okay. It is very highly mobile joint. Okay, which provides around 0 to 180 degree of flexion and abduction. Okay. So it is a highly mobile joint and functionally it is very stable. Okay. Coming to the bony component, that is we are having clavicle. Okay, we are having medial end of the clavicle and lateral end of the clavicle. Okay, so the medial end is I guess it is uh, condylar in nature and the lateral end is flat in nature. Okay, coming to the scapula, so in shoulder girdle, if we talk about specifically, so it contributes around, there are three processes contributes in it. First is the spinous process coming to create your acromion process. Okay, then you are having coracoid process and your glenoid cavity. Okay, then coming to the humerus, so humerus, head of humerus, that is the proximal part, and sternum, that is the manubrium sternum, which takes parts in the sternoclavicular joint. Okay, it is the crown. Okay, crown of sternum. Okay, then coming to the joints, okay, so we are having three main joints in shoulder girdle, okay, that are sternoclavicular joint, okay, acromioclavicular joint, and most important that is our glenohumeral joint. Among these three, glenohumeral joint is the most mobile joint, okay. Then after that, the sternoclavicular joint is the most mobile, and at least acromioclavicular joint. Okay. So yeah, let's get deep into it. Okay, so the sternoclavicular joint. Okay, so the sternoclavicular joint, as you can see in the diagram, okay, this is the manubrium of sternum, okay, and this is what you can see, this is the clavicle, okay. Here, the structure, or else we can say the junction which is formed, that is nothing but your sternoclavicular joint, okay. So the not proximal, so the medial end of the clavicle gets articulated with the manubrium of sternum, okay, or else we can say the clavicular notch of the manubrium. Okay, so the articular surfaces, as I mentioned, okay, those are medial end of sternum. Okay, then clavicular notch of manubrium of sternum. Okay, also at some distinct or some distinct first costal cartilage also gets articulate with this joint. Okay, then coming to the type. Okay, so sternoclavicular joint is a synovial type of joint. Okay, that too it is a saddle variety. Okay, बहुत लोगों को यहाँ पे कंफ्यूजन होता है कि इट इज अ साइनोवियल जॉइंट और इट इज अ सेकेंडरी कार्टिलेजिनस जॉइंट. ओके, बिकॉज इट इज रिलेटेड टू हिप केस, सो दैट्स व्हाई, बट इट इज अ सैडल वैरायटी. बट फंक्शनली देखने जाए, ओके, ये एनाटॉमिकली बात करने जाए तो इट इज अ सैडल वैरायटी. ओके, दिस इज एनाटॉमिकल. But if we go for functional, what lookout, it behaves like ball and socket joint. Okay. Then coming to the articular disc, this is the most important segment. Okay, for what we can say, sternoclavicular joint. Okay, so as you can observe over here, this is the manubrium of sternum. This is this clavicular notch which you can observe. This is the medial end of the clavicle. Okay, and there is a fibrocartilaginous structure present over here, that is this one. Okay, so this fibrocartilaginous structure divides the your overall joint into two parts, that is your superior, middle area and inferior lateral area. Okay, so the function of this articular disc is nothing but as a shock absorber and increases congruency. Okay, coming to the ligaments of your sternoclavicular joint. First is there is anterior and posterior sternoclavicular ligament. Okay, these both are different. Okay, दोनों अलग अलग है, बस नाम सेम है. Okay, then interclavicular ligament. Okay, then costoclavicular ligament, which is the primary stabilizer of the sternoclavicular bone. Coming to the movements. Okay, so we can observe there are five main movements which occurs at the sternoclavicular joint. Okay, so the first one is elevation. Okay, then second is the depression, which is 10 degree. Then protraction, which is 15 degree. Retraction, that is 15 degree. Okay, and axial rotation, that is around 30 to 40 degree. This axial rotation is also known as the clavicular rotation. Okay, and this clavicular rotation further gets divided into anterior rotation and posterior rotation. Okay, so the 30 degree, I guess it is anterior rotation and 40 degrees posterior rotation of the clavicle. Okay. Coming to the next joint which we are having, that is acromioclavicular joint. Okay, so as we can see, the articulation is the lateral end of the clavicle. Okay, then acromion process of the scapula. Then coming to the type of the joint which we are having, it is a synovial variety. Okay, it is a synovial joint, that too a plane variety. Okay, so as you can observe, the thing which I said earlier, that the least mobile joint, okay, in the shoulder girdle, that is acromioclavicular. The reason is it is a plane joint. Okay, so plane joint provides only two types of movement that we will see ahead. Okay, coming to articular disc. Okay, so articular disc prevents. Okay, it is present. Okay, but incomplete in nature. Okay, it is present in the joint. Okay, it degenerates along with the age, and also it prevents. There is one more thing. It prevents, say shock, or else we can say force on the joint. It is kind of a shock absorber only. Okay, I forgot to write over here. But हाँ, वो एक certain age के बाद degenerate हो जाता है हमारे body के अंदर. Yeah. So the next is ligaments that we are having. That is acromioclavicular ligament, as the name suggests. It connects from acromion to the clavicular region. Okay, that too in the lateral end. Okay. Then we are having coracoclavicular ligament. Okay, so the coracoclavicular ligament is actually formed by two different ligaments, or which you can say two different fibers we are having. That is conoid and trapezoid. Okay, the coracoclavicular ligament is the major stabilizer of your acromioclavicular joint. Okay, then coming to the movement segment. Okay, that is we are having only two movements, as I mentioned earlier in the uh, video, that it provides only gliding. Okay, reason it is a plane joint, and causes scapular rotation, that too only in arm elevation. दैट मीन्स जब हम हमारे हाथ को एलिवेट करेंगे तभी जाके स्कैपुलर रोटेशन के अंदर एक्रोमियोक्लेविकुलर जॉइंट जो है वो हमें हेल्प करेगा. ओके, देन कमिंग टू glenohumeral joint. Okay, glenohumeral joint is the main shoulder joint that we can see. Okay, so the glenohumeral joint is the most mobile joint of your shoulder complex, or else we can say shoulder girdle. Okay, so the articular surfaces are head of the humerus and glenoid cavity of the scapula. Okay, एक चीज मैं यहाँ पे डायग्राम में आपको दिखाना चाहता हूँ, that I want you guys to observe over here. You can see we are having a very what we can say very less concavity present at the glenoid cavity, and the convexity, or else we can the size of the ball of your humerus is very large as compared to the concavity. So for increasing the depth, okay, for increasing the depth, there is a special structure which is present over here that I have mentioned ahead. Okay, so remember this point that I am going to explain. Okay, then obviously it is the most famous joint. It is a synovial joint, that to a ball and socket. Okay, then coming to the labrum. Okay, labrum, that is nothing but fibrocartilaginous ring. Okay, functions as provides concavity to the glenoid cavity. Okay, जो मैंने यहाँ पे ऊपर मेंशन किया, दैट इज कि हमारा जो व्हाट वी कैन से glenoid cavity है, it is not that much concave, okay, to hold the convexity of your ball of the humerus. That's why there is a labrum, or else we can say it is kind of a cushion or capsule like structure. It is a concave structure, okay, attached to your glenoid cavity, which increases the concavity or deepens your joints. Okay, it makes deep. Okay, so yeah, this was the function of labrum. Okay, glenoid labrum. Coming to the capsule. Okay, so the capsule which we are having in shoulder joint, it is loose. Okay, then redundant inferiorly, that means it is not supported. Okay, is not supported from the inferior aspect of the joint, and it is weak, okay, in the anterior aspect, and this is the maximum site where the dislocation of your shoulder joint occurs. Okay, so as you can see, okay, uh, imagine this is the capsule. Okay, so there are multiple structures present which reinforce this capsule or the joint from the anterior, from the superior, and from the posterior aspect. But there is nothing which is present in the inferior aspect. Okay, so the inferior aspect is very loose, or else we can say it is very prone to soft tissue injuries. Okay, as we are having axilla over here. Okay, but the thing is, the uniqueness is the anterior aspect. Okay, the anterior aspect of this capsule is very weak. Okay, so that's why the shoulder gets easily dislocated from the anterior aspect, not from the inferior aspect. Okay, then coming to the ligaments. Okay, we are having around 1, 2, 3, 4, 5, 5 main ligaments over here. That is superior glenohumeral ligament, middle glenohumeral ligament, and inferior glenohumeral ligament. Then we are having coracohumeral ligaments, which attaches from coracoid process till the head of humerus, and transverse humeral ligament. Okay, and coming to the bursa. Okay, so we are having three bursas. That is subacromial bursa, subdeltoid bursa, and we are having subscapular bursa. Okay, as the name suggests, it is below the acromial process. It is below the deltoid muscle. Okay, and below the scapular region. Okay. Then coming to the movements, which is the most important segment. Okay. So there are, I guess, there are 7 to 8 movements. Okay, which are present in the shoulder joint. Okay, that is first is flexion. Okay, so the flexion is 0 to 180 degrees. Yeah. Okay, it is done by the anterior deltoid fibers and clavicular head of the pectoral muscles, or else you can say pectoral major more specifically. Then the extension is done by the latissimus dorsi and posterior deltoid fibers. Okay, coming to the abduction is divided into three segments, that is 0 to 15 degrees, 15 to 19 degrees, 90 degrees, and 90 to 80 degrees, 180 degrees. Okay, so the 0 to 15 degrees is carried out by the supraspinatus muscle. Okay, then 15 to 90 degree is carried out by the middle deltoid fibers, and above 90 degree it is carried out by scapulohumeral rhythm. Okay, it is a special type of a what we can say biomechanical movement which happens between scapula and humerus. Okay, it is actually when the abduction goes above 90 degree, your scapula starts to move in a circular rotating motion. Okay, so it it is ratioed into like 2 degree of humerus will be rotating and 1 degree of scapula will be rotating outside. Okay, then yeah, we are having some supportive muscles also, which are also known as accessory muscle, that are trapezius and serratus anterior. Okay, then coming to the adduction. Okay, adduction is done by the latissimus dorsum and pectoralis major muscle. Okay, then coming to the external rotation, that is done by infraspinatus and teres minor. Okay, these are the parts of rotator cuff. Okay, the rotator cuff के components है. इनफैक्ट हाँ, सब स्कैपुलरिस भी रोटेटर कफ में ही आता है. ओके, yeah, so the internal rotation is done by your subscapularis, then pectoralis major and latissimus dorsi. Horizontal adduction, okay, it is a special kind of what we can say movement that that is performed by, or else we can say carried out by, posterior deltoid fibers, infraspinatus and your teres minor. Then horizontal adduction, it is carried out by pectoralis major, anterior deltoid fibers and your coracobrachialis muscle. Okay, so yeah, that's it for today. Thank you very much.